what everyone should keep in mind is that when you're dealing with CMS at that level, more than likely you're dealing with a human who truly is trying to do a good job, but you're dealing with a human who actually probably doesn't have any medical background. And even if they do, they work for CMS. And there is a list of questions to ask, and there is a list of acceptable answers. And they don't have the authority to veer off of that. Now, if you are a healthcare provider, if you're a physician or a nurse at the bedside, you're very aware of the fact that there are no two patients alike. You can't treat them from an instruction book.
Exactly.
So that discrepancy between the two worlds of the practitioner and the overseer it's designed to fail, as I believe you said at the outset. So there is not a good solution for that other than to knock the whole thing down and build it from the bottom up.
Yeah, that's a very good point.
You raised a really important point too. And to your point, the person that I would have to report to was an LPN. They had several LPNs on their panel, and they didn't have wound care experience. And so I had to defend myself. And finally, one day I lost it. I said, you know, this is what I do every day. This is what I've been doing for years. What's your level of expertise? And they just kind of laughed. And I said, no, I'm serious. I said, you don't understand all the issues that are going on here. And furthermore, you have to understand that I'm being a good steward of Medicare's money, but you're taking it out on the little guy. I'm not the problem. It's like I'm the one who's gouging the system.
The interesting thing, if you had just simply coded your place of service as an office, you would have never heard from them.
Yeah. But you know what? It's like, Randy, again, no good deed goes unpunished.
There you are.
Because I was being honest, I put myself out there. It's still kind of a bitter thing after all these years, because that for a year and a half, I mean, it really disrupted a lot of things in my life, put a lot of pressure on and a lot of stress on me personally, on my practice, etc. It was terrible. And the thing is, we were really thriving. We were doing we were doing a great service for Jacksonville. We worked with any number of home health agencies. And, that was another thing too. It took a lot of the pressure off the home health agencies, because you all know the disconnect in wound care. The patient's in the hospital. Who writes the home wound care orders? Generally, the attending physician doesn't know anything about wound care, writes home health wound care. That's it. So now the patient's discharged to home. It gets dumped on the home health nurse. They don't know, a lot of times the nurse who's been there the longest kind of now takes charge. Well, they would consult with us. Number one, we'd give them the guidance that they needed. And this is even with visiting physicians too. They didn't know how to do wound care. So we would help them out, but also would cut down the number of visits that they would have to make every week too. And, reduce some of their resources. So, it was such a win-win, and it was the solution was right in front of their eyes, and they didn't get it. And that was part of the frustration. So I didn't mean to hijack this conversation, but it was so relevant, and I'm glad to see somebody's picking it up. And I sat down with a venture capital guy who loved our business model. The problem that we found that I had at the time, we didn't have telemedicine. So I couldn't really keep an eye on what was going on. Let's say if I wanted to have somebody set up in Daytona or Tallahassee or other places, I didn't have that ability to do that. And so my little practice and me, I was kind of the rate limiting step of all this. And so I could only really venture, in Jacksonville, grow Jacksonville. But man, if we had this model today, it'd be gangbusters.
It's a different world now with technology.
So Wendy, can I ask you a question?
Of course.
So, moving to 2021, what are your hurdles to doing this now?
So Woundtech actually has a very interesting business model. They actually contract with the insurance companies directly. They don't even deal with Medicare.
Smart.
You're dealing with large insurance companies because they could show the value and they actually listen to them. So we're not, unfortunately, at this point in time, serving the Medicare population. We're looking at private insurers and making those contracts independent.
Very smart.
It's a value-added proposition. You can show that you're saving tons of money, preventing patients from going to ED or getting hospitalized or having amputations, and we can provide good health care. We can also, like you said, support home health care. We don't have to have home health care in the homes. We can provide these services if the patients stay in their place of care, their home where they want to be. There are studies that show patients are happier and healthier if they can stay in their own home environment. And then, of course, during the pandemic, this model grew exponentially because patients were told to shelter in place. They were scared to come to the hospitals and concerned about coming to the doctors. And we know we've seen all sorts of research that shows so many different aspects of health deteriorated during that time, be it, cardiology, patients were suffering from heart attacks and strokes and you name it, because they were scared to go to the hospital. It's just crazy. So
yeah.
It was really a perfect time to really grow this, and it's
absolutely. Telemedicine has been, or COVID's been one of the silver linings of COVID has been telemedicine.
I agree.
Moved to the front of the line for sure. Mm-hmm. It's so invaluable. It doesn't matter if you're in a rural setting or where it takes 5 hours to drive to see a patient, or inner city where it's just physically difficult to get these patients transported into the right setting. You can do so much more. And so much more efficiently too. Mm-hmm. So I think your model, one of the things, you guys are smart. When we were figuring it out on the fly, we were just trying to solve a problem. We weren't really thinking in terms of the business aspect of it and demonstrating through statistics and cost savings to the insurance companies, which we did private insurance as well. But had we, that different perspective, a couple little things missing at the time, listen, we knew that it worked. Now being able to tinker with adding telemedicine and showing the cost savings, there's no reason that insurance companies will not be all over this. Not to mention the socio aspect of it too. Patients want to be home. You do better at home. Well, you all know this, everybody. When you're making rounds on your patients, all they want to do is go home. That, when you're doing your hospital rounds or even post-operatively, especially around the holidays, their whole goal, it's not necessarily to get better. They just want to go home. Yeah. And you can't fault them for that. That's all I can say.